Okay, so I would like to introduce myself. I'm Anita Jean or Anita Jean. I'm Francophone, and I'm with the NorWest Community Health Centers in Thunder Bay. And I'm working on I'm a manager here with the organization. And for the past 2 years or so, I've been on secondment on a digital health equity project. Through COVID, we've seen a lot of individuals that were isolated, obviously, because we had, we couldn't go out and meet face to face. And one of the things that really was of concern to me was the isolation of seniors. So a NorWest Community Health Centers essentially did some projects on how to get seniors online, also looking at good practices in terms of if you're going to get healthcare online, because everything moved virtual. So let's get started. This is actually relevant to just about anyone. So not unique to Canada, not unique to Thunder Bay. However, it came from university in British Columbia, which is our westernmost province in Canada. And so the University of British Columbia, the Intercultural Online Health Network, Faculty of Medicine at the university, developed this program, essentially provide really good quality information so that they could present this workshop. So technically what I'm presenting, they have produced a few more credentials in terms of who has developed the content of this program. And the one thing I have to admit to, though, is British Columbia was cutting edge in developing a lot of resources and moving to an online platform to offer healthcare, especially during COVID. I'm not sure if they were there before, but they've done an awesome job. So essentially, we're going to review how to identify high quality, reliable health information and lesser quality, lower quality information. We'll test out some examples and practice them out, and then review the findings at the end. Okay, so essentially what we're looking at are where there's going to be more of the green flags indicating high quality as opposed to red flags. We're going to identify what those flags are. If there's more green, the more reliable the information, more red, the less reliable the information. And we're going to see some websites. You can have a blend of both. If you have more red flags, information is less reliable. At the other extreme, more green flags, the information should be more reliable. And you may have a blend or may not be reliable. So it depends. You have to identify those flags, and things change overall. Giving you the tips on how you can assess the information for yourself when you're going to a website. So you're looking at two examples of information that's online. So what's at the left looks pretty good. You have what might appear as a good website. On the right, you're looking at a few things. It's kind of a little bit busy there. You have some advertising, you have other things going on, which might be hinting to us that may not be such a good source of reliable health information or high quality health information. So right off the bat, you're probably able to see a few things that might make you question the quality of that information. If you look at the examples we've just previously seen, the first thing that jumps out at you is the website on the left, trying to educate, provide good information. So that's a green flag. The one at the right, trying to sell you a service, a product, there's other things going on. So a bit of a red flag. Some experts are checking the information. The website is up to date. There's a date when the information was there. Meanwhile, the website at the right, not checked by experts. There's no date. There might be some incorrect information, and there's other things that are not health related there. We've just given you a few of the maybe like 3 things that to look for when you're looking at the reliability of a website. So we're going to step in some actual cases here. So if you want to find health information, the internet is a wonderful opportunity. You can find some information to help do self-management. If you have a condition or like, diabetes, if you have an illness, if you want to find some material on how to optimize your health, eat well, it's a good place to find some really lovely health information. But it's how to look for this health information. First of all, you need a search engine. So most of us are, using Google. There's a few other ones like Firefox. You might be using something else, or Chrome. Google's probably the standard we're going to use here. Find the one that you are most comfortable with, and it's essentially to identify the information. So here's a couple more tips. So you're going to be looking for a website that ends with gov, org, or edu. Gov would mean it's a government source of information. So it could be Canadian, it could be from the state. .org is a non-profit organization, the Cancer Society, or diabetes organization. If you have .edu, that would be an educational institution like the university, of BC, so their program. Maybe there's medical schools or things like that. So these would be green flags, places that would typically have really good sources of information. If you're looking at a website that's .com, it's a commercial business. They're going to be likely trying to sell you something, either like immediately or get your attention. It doesn't mean it's not potentially a good source, but typically tends to be less reliable in terms of health information. If you have this example, and I believe this is an American example, .gov. So this would be an example of a good website for information. Let's look at the next one. Again, this is an organization. This is a nonprofit organization. So typically not going to be trying to sell you something. Let's look at the next one, iconproject.org. These are the folks that produce this presentation. So these are all examples of good websites or sources of information. Let's look at the next one. Another one here, so .gov, and you can see Center for Disease Control and Prevention. It's about educating people, and it's about specific questions on topics. And I'm looking at, they're talking about preventing the flu, symptoms, treatment. Nothing on the webpage here is trying to sell you something. Likely will be a good source of information. Let's look at the next page. And you can see at the page the information when the last update occurred. So you have the last update, how old the information may be. Like, for example, if I would be looking at this website right now, last update, May 8, 2020, 3 years later, if I'm looking for some information about the flu, the information I would say is probably out of date. Anything that is a few years within the health system might need some update. This is just to give you an example of, here's some green flags, but still it's within a context. You look at today's date, but at least you have a date stamp. Let's look at the next. Look at this, Buy Now. So this is, again, it's a website for cold and flu, and maybe has some very interesting information, but you can see they're trying to sell you something. If someone is trying to sell you something, it will be a red flag. The one thing that I should say right off the bat, if someone is asking you from a website to submit information like your name, your age, your address, anything that is identifiable to you, or they ask for a payment. I would be very leery about that. So it's probably okay to go and see. Do not click on any of the links or the advertisement, and do not submit the information online, okay? It may look like it's local, it may look like it's American or Canadian. Do not assume that. So it's like opening the door to a stranger. You don't want to do that. There's better sources of information up there. Let's look at the next. There's a fee here, and look at that. They're asking for your credit card information on it. So you're making an inquiry about health information, and here they are asking for some identification, some payment. You have to submit that before you get the information. The other one is sometimes you'll have to submit a profile, information about you, and they're going to say, okay, information is going to be sent into your email. You have to submit an email address. Again, be wary of those websites. You should not, if it's going to be a reliable a website, should never be asking you about any of that. So red flags all over the place here. Next page. Oh boy, don't you just love that? You have a bunch of ads on the side there. You might have even been browsing that store just before, and somehow the ads are popping in. Other sponsored ads, things like all over the place, but you have a little bit of the information in the middle. Ironically, if you're looking on some websites for recipes, you'll find some of the websites have a lot of these ads around. Just don't click on any of that. But if it's health information, again, these are things I would question the source of the information. They're just trying to get you there, and they're trying to have you click on something to sell you something. So I would stay away. This would not be a good source of information for me. If you look at this one, so HTTPS, so that means Hypertext Transfer Protocol Secure. So this is an encryption to ensure communication, secure communication over a computer network. It should be a sign that it is relatively secure, but there's no guarantee. Even if you have HTTPS, what used to be a few years ago, very secure, right now there's no guarantee. So you would have to essentially look for the flags, but it's generally more of a good source. Okay, so if you type in doing a search and then you generate something, a search results, HTTPS, probably a better quality. But there's not one way of asking the question. There's many ways, and the closer you get to asking the question, essentially, you're going to get different results, or you might get better results with different questions. Here, you end up somewhere by now. They're promoting essentially a product. So the health information essentially is to get you to the website so that you buy their product. Red flag, I would suspect they would be biased to their products. So the health information there would not be high quality. That would be a red flag for me. Do a Google search, and it specifically says, if you look at just before the HTTPS, it's an ad right there, something like that. Before you go to the website, it's going to be an advertisement. They're going to try to sell you something, probably not a good source or the better source of information. They'll be biased for their product. They're going to try to sell you something. Red flag for me, I wouldn't go there. And the other one here, I don't think they meant Brian. I think they meant the human brain is still evolving. So if the information that you're seeing some spelling mistakes, that's a real giveaway that it is not a good source of information. Okay, so red flag. Oh, the other ones are forums. So the forums, as anyone can post an answer. Sometimes it's been helpful, but you have to take it with a grain of salt. This is not a reliable source of information in terms of it's not independently tested and all of that. It's very much a layman's or layperson information that they're sharing. if you're looking for information, you could get lost in those forums. So it might be interesting to look at, but it's like talking to your next door neighbor. Would you take medical advice from them, health information from them? It's give and take. So I would say red flag for me. And this one here, pretty obvious. They say forum. And, you know, is it bad to take Advil and Tylenol together? So you have some question and answer. Again, do we know who is making the advice? Has it been verified? Are there some experts for health information? Not the best source of where to go. I would not take a forum where there's question and answer as a good source of information for health. That's a red flag for me. What is a green flag? It tries to educate you, sharing accurate information provided by experts, verified by other experts, current and up to date. There's a date stamp, and it comes from a website like the government, an organization, a nonprofit organization, not trying to sell you something, or an educational institution. Less reliable information will try to sell products. It's not verified by other experts, may not be up to date, may have incorrect information. It is from a business with a .com website. I'm not saying that their health information is not good. It would tend to be less reliable, not the place I would look first for some information. So we're going to practice. We're going to look at a couple examples. Okay, you have a question, a specific question, taking some medication for high blood pressure. And you're wondering, can I take Advil and this medication? So is it good or not good? This is not something that you want to wait until you get to talk to a nurse or a doctor. You might want to, just do some search, look online. How would you go about doing that? Look, then it's like, how do you ask the question? So here's an example. Take Advil with Ramipril. This is how they've asked the question. Let's see what comes up. If we look at HTTPS, so we see that it's not an ad. Those are like, at least you have one good green flag here. Okay, and you get there to the page, .org. There's no ads that you can see. You're not being asked to pay anything. So it's got 3 green flags. No red flags so far. So right there, I would say it would tend to be a reliable source of information. And you can see there's some information. There's just no spelling errors. Right now, there are 2 more green flags. Everything is looking pretty good. Nothing that to me would bring a red flag, but I'm not like that content expert. So looks good to me. Okay, so this is one of those, it's like, it could be very broad. Will certain foods help me feel better? Okay, because I'm depressed. Let's look at food and depression. So here, the question, you might want to try a couple of things. So what foods might help with depression? Obviously, the 2 common things, the food bit and depression, you could type the whole question. So there's no right way to ask your question. There's just better ways. So as you type in your questions, you might need to redo that inquiry and see what it gets. Let's see what this one has gotten. Looks like it's an edu, so that would be an educational institution. Harvard looks like it should be good information. So you can read the title a little bit. A good source of information for you. You want to check it out. Here you might get another result. So you can see right there with it's an ad. They're letting you know it's an ad before you even get into the website. Money back guarantee, free shipping on orders. So right there, we have a couple of red flags. I would not go to this website for reliable health information. So the .com, selling supplements, labeled as an ad. So you have 3 red flags there. No green flags, bunch of red flags. That would be something I would suggest you avoid. How to decrease blood sugar. Obviously, a couple of things, blood sugar related, decreasing your blood sugar. You could even type in decreased blood sugar. We could see how things get generated. You might want to ask a few different ways. So then, .com, obviously, it's a business. Couple of ads right on the side. And I don't see any updates, like when this information was created. Maybe, you need to go further down, but right off the bat, if you see a bunch of pop-up ads on the side, those would be red flags to me. So you have a few red flags right there. So not the place. I would consider that lesser reliable health information. Okay. The next one here, a little bit more reliable. You see it's .gov, so a government agency. You do not see any ads. Right off the webpage, you can see when it was updated and the content source right below. Chances are right now, a couple of green flags, no red flags coming up. This would be a source of more reliable information. In summary, reliable source of information online. They're trying to educate you, share this information with you, comes from expert, is reviewed by experts. There's a date, should be current. If it's a little out of date, take that with a grain of salt, and comes from either the government, a nonprofit organization, or an educational facility. The red flags would be someone trying to sell you a product, trying to get you to submit your credit card information online, not verified by experts other than their own, may not be up-to-date information, and comes from a business. Okay, so that is essentially the content of the presentation from ICON.